So we're going to go into our questions, and we have about 15 minutes. And Maureen has the mic. So if you have a question for one of our panelists, please. Okay.
Hi, my name's MC Bredner, and I just wanted to thank Wendy for her presentation because I also do research with people with episodic disabilities. And throughout my research, one of the things that has been the most frustrating for me was this comment that workers would tell me that they were lucky because they had an employer that would give them the accommodation that they need. And you referred to it as soft accommodations. And I also work as a union rep for the United Steelworkers, and I negotiate with employers all the time, and we deal a lot with episodic disabilities. And the thing that's really hard to get employers to understand is those fluctuating needs. And I was just wondering if you have suggestions or systemic policy suggestions that we can advocate for that would actually help workers with episodic disabilities to try to help employers figure out or understand that these accommodations are needed and are part of that requirement that they have, whereas, because right now I feel that a lot of employers just kind of sideline those soft accommodations as being a worker who is, like playing the system or doesn't actually need it, because some days they can do that and some days they can't do that, and they have a hard time negotiating that.
Thank you. It's a great question, and I wish I had an easy answer. I think there's a lot wrapped up in your question, right? So one of the things that you're asking about is policy frameworks that could be implemented at an employment level. CUPE has a statement on HIV at work, and they have actually, it's the first one that I've seen, they've put into the statement the concept of episodic disability. So it actually shows up as a conceptual model, a way of thinking about disability. And I think I'll send you a link to it, and if anybody else is interested in seeing it, it's great to see it reflected that way, because it's the first time that I've seen it reflected in kind of a big policy document. One of the problems is, and I was saying, we don't have a formal definition of episodic disability. It's a really new concept too. Really, the definition that I quoted there is one that we've used for years, but there isn't a broad-based agreement. The episodic disability population, as we've been talking about, doesn't exist in a lot of the data too, right? So this is a new thing. Although I am happy to say that in the 2017 Canada Survey on Disability, there is a marker for episodic disability in the new one. So a number of us worked with StatsCan to come up with some questions for that. So moving forward, at least there'll be some data to fall back on in terms of understanding what the policy should be. One of the things I think that you're talking about is stigma too. And I think we really haven't talked about it very much here, but certainly in my work with people with HIV, and for people who work with people living with mental health issues too, there's a lot of stigma there as well. And one of the main things that I think the evidence has shown in terms of reducing stigma, when you can do it, is contact with somebody who's willing to talk about their lived experience, right? To be able to say, I'm a person living with. These are the kinds of things that I need at work, not an employee necessarily, but somebody from external organization. So I don't know if that helps, but we can connect after maybe too.
Great, thank you. Maureen, you have another person with a question?
Hi.
Hi.
I'm Douglas Waxman. I'm a doctoral student at York's Critical Disability Studies program. It's not a question as much as a comment. I'm concerned about the use of the word adjustments. The word adjustment sounds like and I fully appreciate the need to talk business speak when you're talking to businesses, and it sounds less threatening, but it sounds charitable as opposed to a right. And I think it's much more powerful, and employers need to know that people are entitled to reasonable accommodations, and that those were hard fought, right? There are people in this room who have worked very hard or at least the predecessors who worked very hard to get that into it. And what is it's not legally defined, right? Reasonable accommodation is legally defined. So anyways, I just wanted to pass that on.
Great, thank you. Anybody want to speak to that?
Can I just make a comment? I worked in the UK for a number of years, and they use the term reasonable adjustments, and it's used in the same way that we use accommodations. My concern, and I know somebody was talking about the legal context, we would live in a legal context, right? And my concern about the switching of the terminology is that where are the protections? So if the protections are tied to an understanding of accommodation, it's really important that we maintain that, because as we all know, you can be in a position to have to defend your right to an accommodation, right?
Okay.
My name is Alexis Butkin, and I am a researcher, so I have a question based on previous research, and I wrote it down so I'd stay on time.
Excellent.
Previous
you.
research indicates that job seekers with disabilities are at least somewhat dissatisfied with employment services, claiming that providers do not effectively include them in their own hiring practices or in the design and implementation of services and supports. So my question is sort of geared towards the presentation on CCRW's work, and I'm wondering how CCRW ensures that services are accountable to job seekers with disabilities rather than accountable to funders, because we know that there's challenges around funding mechanisms for service providers. So I was wondering if you could speak to some of your innovations in that area.
Sure.
Thank you.
Thanks, Kathy. It starts with employment, and it starts with having the one-on-one conversations with those job seekers, and then being involved in every step of the process, and ensuring that their privacy is also protected in that process. And that's something that we talk a lot. For CCRW, we talk a lot about that with our frontline staff and our job developers who are working one-on-one across the country with job seekers who are looking to get into the labor market or back to work. And one of the things that we hear all the time is, the types of questions and the way we engage in conversation with job seekers is really involving them in the process, and it's a client-driven approach. We're not out there selling disability to employers. We're matching the skills that the people we serve have with the need that we've recognized that employers have. So I think from CCRW, the programs that we have, specifically our largest program, which is the Partners Program, which is in 10 sites across Canada, what we're hearing is that, because it's a client-driven approach, because they're being a part of that process and we're listening to them, and we understand the employer's need, that sense of satisfaction is there with the level of service that we provide. So.
My name is Chris Hornberger, and I'm a management consultant in Halifax. And my question is for Beth. I've been on a board for entrepreneurs with disabilities for about 5 years, and we don't provide loans or anything like that. So it's primarily mentorship and supports of one kind or another, and the funding for EDN comes from various government agencies. And I'm interested to know your success rate in terms of entrepreneurs with mental health illness staying in business, and how many of those businesses are essentially self-employment versus business, where they're engaging other employees and looking for growth in their business and so on.
Thank you for the question. Is it Brian Aird that you work with? Yeah, okay, I've spoken with Brian. So your question was about our success rates, and there are a couple of different ways that we measure success. In an ideal world, we would be in contact with every single person we've ever worked with, and they would be reporting to us regularly on their business success. We try very hard to do that. But sometimes it's difficult to keep track of people. So what I will say is there are a couple of different things that we track. We track our repayment rates, for example, the people that pay back our loans. And right now we're sitting at about 7% default. So that's pretty good. It's comparable to a bank that would be lending to small businesses. And your other question was about how many people are starting businesses and creating jobs as opposed to just starting businesses for themselves. And to be honest, we don't make the distinction. Our purpose at Rise is to help people start businesses for themselves. And so it's probably safe to say that the majority of businesses that we start are micro businesses. And that could be something in the skilled trade, somebody who is a drywaller. That could be somebody who is a caterer. So we don't have really great statistics on job creation, and we don't tell our funders that we will have those statistics because they're hard to find. But we do keep track of our entrepreneurs, and as I said when I was up there, not all of them stay with their businesses, but they do learn and acquire skills. So, but for the most part, they are smaller businesses. That doesn't mean there aren't some people that we fund that end up hiring a lot of people, because there are, but for the most part, they're sole proprietors.
Okay, go ahead.
Thank you. My name is Mary Gasella. Again, thank you for those very interesting presentations. My question relates to your comments, Wendy, about episodic disabilities, because one of the areas that is particularly difficult for people who have such disabilities relates to the Canada Revenue Agency Disability Tax Credit, which is very, very is applied in such a way that very few people with an episodic disability could ever qualify. Yeah. And it remains a serious issue because with the ineligibility for a disability tax credit also comes the crashing down of a registered disability savings plan that the person may have been putting money into and losing a lot of money for having to cash it out.
Yeah. Okay. Yes, you're right. It is a huge issue. And in fact, it's something that we've been just recently talking about again at the Episodic Disability Forum. So we have a forum that has, many of the folks in here are members, so representatives from organizations that represent people living with episodic disabilities, as well as researchers and other folks that have an interest in the area. And we've just recently been talking about this question again. So what do we do about how exclusive the disability tax credit is to people living with episodic disabilities? I was talking to Margaret Parler, do you know Margaret? From the National CFME Action Network. About this, and they've been doing some letter writing, and they feel like they've had some success recently. I guess there has been a committee struck to look at the disability tax credit again. So hopefully we'll be in a position to submit something to the committee to reconsider this, because as you say, it locks you out of a whole series of things.
I got the 5-minute mark, so we just have time for one more question.
Thank you very much. My name is Bill Shador. I'm the National Coordinator for the Canadian Injured Workers Alliance. And I just wanted to make a couple of observations, if I may. One of the things is that, I know it was mentioned a couple of times, but I just mentioned earlier, but episodic disabilities or whatever. What we have done over the last 2 years, we've been working with an organization called the Canadian Pain Coalition. And we put together a project which we received some funding for from the federal government and some organizations that have given us money as well. But it's got a long title, and I'm trying to find a way to shorten it. But it's called Creating a Way Forward, Developing Guides for Collaborative Practice and Support for Injured Workers Who Live and Work with Chronic Pain. And we've had a couple of forums on the issue with face-to-face meetings. It included doctors, physiotherapists, occupational therapists, psychologists. We had a lot of professionals who wanted to have a say in the whole issue of chronic pain and how it's dealt with in this country, and how people are trying to get into the workforce or return to the workforce after being injured. I'd just like to pose one quick question. How many people in this room are injured workers who are dealing with chronic pain? Quite a few. I have one here. So we don't have a really good number or statistics on that particular issue, and we're trying to find ways of getting that. And we're hoping as we go along on this project, and we're hoping to further this project and to also get into other details like data on that issue alone. Because the whole issue of chronic pain and persistent pain in this country, it's basically it's cost about $50 billion as an estimate. And it's also estimated that 1 in 5 people at some point are going to wind up with chronic pain or persistent pain of some kind. That's a staggering statistic when you think about it. So I just wanted to actually talk about that, tell you about what we're doing. We just did a webinar last week, I think it was, on the issue as part of the project we're doing. It's on our website, Canadian Injured Workers, or CIWA dot what? .ca, okay. Office manager Janet is here. Keep me honest. So if anybody also wants to be involved in the project, I know I've been talking with Steve about this and other things that we're hoping to be involved in. Just let us know. Contact us at our website email address. Okay? Thank you.
All right, we're finished and we're 3 minutes under. We've got one last question, 3 minutes.
Just a quick question with regards to, I think it was Aaron that was addressing sort of that disability prevention, and then CCRW has sort of this new concept of contractual agreement as far as the service that you provide for that match for the talent. So my question is, in the identification of everything that I've done, barrier still is the most challenging thing to look at. You say that you identify barriers and solve that issue in order to ensure that there is the greater percentage of disability prevention. You're saying that you have a contractual obligation to those you serve on both sides of the equation. How do you manage the identification of those barriers?
Use the microphone. CCRW is lucky enough to have a social enterprise called JAS, which is our Job Accommodation Services. And that is something that we're able to use with employers, employees, as well as anyone else in the process. It was part of my presentation, but given my time limit, I jumped over a few parts. But that allows CCRW on both sides of that contract to come in with an occupational therapist, at work prior to going to work, and facilitate, having that accommodation piece to ensure that some of those barriers are no longer there. But, the key to that is that ongoing support and that conversation, like you said earlier, Jamie, to make sure that you're doing that check-in. Is that still working? What can we do better? How can you be your best self at work? So, CCRW can utilize JAS as an employer can independently of CCRW to ensure that they have that service available, for that accommodation piece. And, when you're putting those pieces into play, you're able to work towards that prevention, for any further, injury at work, or, to ensure that an individual is their best self at work. We do have a representative from our JAS team here, Emily, if anyone else is interested in learning more about that.
Great. Thanks. Aaron?
Do I just push the button, or is it on?
I think so, yeah. Or it should be coming on automatically.
Okay. And I'll just be quick, too, and I was doing similar to Megan. I was kind of realizing I was running out of time, so I didn't get to go into the full sales pitch, but that would be something that's looked at through the situational assessment, and then the report that gets produced, which essentially is, again, identifying the gaps, identifying where improvements are needed, and then we devise essentially a plan based on the individual needs of the employer. So that's my quick answer.
Great.
You can come and see me and Jody and talk more. So
Absolutely. So we're at 4:30. Thank you, everybody. I really appreciate all your presentations. Really, thanks so much. We're at 4:30. Wow.